Hello everyone. Now we are going to see about hypertension in pregnancy. So what do you know about the term gestational hypertension? When the BP is more than 140/90 millimeter mercury in pregnancy more than 20 weeks of gestation. So that is gestational hypertension. So only after 20 weeks of gestation the BP should be more than 140/90. So that is gestational hypertension. But what do we understand by chronic hypertension? When the BP is more than 140/90 or when there is an elevated BP much before that, even before that. So say when they are having an elevated BP in the first trimester or else in the first 8 weeks or else, then that is known as a chronic hypertension. Only if it is elevated after 20 weeks, then it is known as gestational hypertension. Similarly, the elevated BP after 20 weeks should come back to the normal level after delivery of the baby. But if the BP is still persistently high, then that is known as chronic hypertension. So that 20 weeks to the delivery of the baby, when the BP is high, it is gestational hypertension. Anything apart from this, even earlier or even later, it is known as chronic hypertension. What do we understand by the term pre-eclampsia? Pre-eclampsia is when the BP which is high, when there is elevated BP and it is associated with proteinuria. It is known as preeclampsia. So BP high with proteinuria is preeclampsia. Now what do we understand by the term severe preeclampsia? Whatever the values are there, if it is very severe, say the BP more than 140/90 is gestational hypertension, and along with the proteinuria is preeclampsia. Now severe preeclampsia is when the BP is more than 160/110 and or when the proteinuria is more than 2+ and or when it is associated with organ damage. So what kind of organ damage? How will the organ damage be presented? So the liver, when it is hepatic, when there is elevated LFT, then that means that there is an end organ damage over there. In CNS, when they present with visual disturbances, when they present with headache, then there is an issue over here. In lungs, when they present with dyspnea, when they present with edema over the lungs, and when they present with decreased saturation, then there is end organ damage. So when either one of these, or even if more than one of these is present, then that is severe preeclampsia. Now what is eclampsia? When it is associated with seizures, eclampsia means seizures, then it is known as eclampsia. Now what is the prophylaxis and what is the treatment? The prophylaxis is magnesium, as well as the treatment is also magnesium. Magnesium is the prophylaxis as well as the treatment for eclampsia as well as severe preeclampsia. Now what about the final cure? How will we be able to cure the patient from eclampsia or else by preeclampsia? Delivery of the fetus. Termination of the pregnancy is the cure to treat eclampsia and preeclampsia. Now what is the reason? Why should all this happen? This is because of the uteroplacental insufficiency, which happens because of vasoconstriction of the placental vessels. So because of vasoconstriction of the placental vessels, what happens? Why should vasoconstriction happen? The vasoconstriction can happen idiopathically, or it can happen due to SLE, or it can happen due to smoking. So SLE, smoking are the most important causes, but idiopathically unknown reason can also result in vasoconstriction, thereby leading to either of these. So when there is a vasoconstriction, when there is uteroplacental insufficiency, then all the mediators have been released and it results in this wide spectrum. So this is in short about the hypertension in pregnancy. Thank you for all listening. I hope it helps you all. Bye.